I'm Dr. Manish Mannan. I'm head of pediatrics and neonatology at Paras Hospital here in Gurgaon. Today being the World Asthma Day, I thought I'll sensitize you on asthma in children. Asthma, bronchial asthma as we medically call it. So basically the pathology in a layman's term is that the airways, they constrict from its normal size. There is inflammation in the inner mucosa fluid, thereby causing difficulty in breathing. This happens because of various triggers. One of the most important factors is genetic. If it's there in the family, it's likely to be there in the child. And then there are environmental factors. Environmental factors as in change of temperature, weather, pollution, sometimes certain kinds of foods, inhalants, perfumes, mosquito repellents. There are many things. Some person A, child A may be allergic to a particular thing, B may be allergic to a particular thing, and these could be the precipitating factors in precipitating that particular episode of bronchial asthma, as we call it. Now, when we talk about asthma in children, what is so special about children and why is it so important for us? The respiratory passage of children is much smaller than that of adults. Hence, when there is an episode, the chance of child developing a breathing difficulty is much higher than that of adults. If some of us must have read physics, so from that you know the diameter of a pipe and the resistance have got a ratio of about 1:4. So they are about 4 times the greater chance of having a difficulty in breathing and the symptoms thereof. The smaller the child, the greater the chance of developing a respiratory distress. Hence, the moment a child develops any respiratory distress, any difficulty in breathing, the problem should be addressed. So how do you deal with this problem? There could be a child who may get an episode, say twice in a year. There could be a child who may get an episode every month. There are 2 things to it. One, you treat the present episode. Second, we do something that these episodes do not act again and again, do not happen again and again. A lot of my patients, when they come to me and they say that because the child has bronchial asthma, we don't allow him to swim, we don't allow him to play football, we don't allow him to. So if we are going to restrain our children so much, then we are not doing the right thing. Aim of the treatment is such that the child should be able to do anything and everything that he wants. So herein we give certain things called as preventive treatment, maybe in the form of inhaler or some anti-allergic medication. As per the guidelines, we give these medications for a period of at least 3 to 6 months, for as long as the child is absolutely asymptomatic, and then we stop these medications. Certain myths I want to clarify. One, people think nebulization is going to melt your lungs or is bad for lungs. Wrong. It is just a method of delivery of medication into your lungs. 2, if you start an inhaler for a child, it is going to be lifelong. Wrong. It is given only for a certain period of time to prevent an episode from happening. I often tell a lot of my patients that you bring your child to me so that your child doesn't fall ill, rather than he falling ill and coming to me. Not falling ill for a longer period of time, it's a greater possibility that the child may remain well for a longer period of time. So prevention is better than cure. Second, many times mothers are able to tell us, whenever my child has XYZ, he develops an episode. Note down those things, what we can do. Third, in a particular kind of season or in a particular kind of weather, the child is more likely to have these episodes. Consult your doctor. This season is coming, this kind of a weather is there, I know he gets such episodes. What should I do so that he doesn't fall ill, he doesn't get into that episode of bronchial asthma wherein he requires a treatment or even hospitalization in so many instances. So prevention, trying to find the cause and addressing the issue, that is the main thing. Genetics we can't change. If somebody is genetically sensitive, somebody is genetically predisposed to a particular kind of a allergy, that is something we can't change. But other aspects, environmental, aggravating factors, that is something which is in our hands. Prevention by way of medication in our hands. So that is something, I would really tell all the parents to take care of. As far as possible, avoid a situation. Follow the advice of the pediatrician. Don't stop medications on my own. Many times I advise a particular medicine or inhaler. I say, okay, you give it for a month, come back to me after 1 month. They come back after 3 months and say it's happened again. We don't want that, We'd rather want that he comes, we titrate the medication and a long period has passed by and the parents say, okay, the child is fine. You will notice one thing: as the child grows up, the respiratory apparatus, this is the only system in the body which grows even after birth. Year after year, the things will improve. It has to improve medically or anatomically till the age of 7 years, because till that age, the size of respiratory apparatus increases. So be optimistic, take adequate preventive measures, know what your child is sensitive or not sensitive to. By no means prevent your child from participating in any sports activity. That is not done. So in bronchial asthma day, I would rather say be alert, be safe, prevention is better than cure. Thank you.